Hi, good morning. So right now I'm gonna perform an arterial blood gas. So first is before going inside to the patient's room, we always make sure that we're gonna check the patient's chart, look for the physician's order if they really have wanted to obtain an ABG to a patient, and then check for other informations that is very important during arterial blood gas extraction. So once inside, we always make sure that we introduce ourselves, and then we also have to greet the patient and then explain it to them why they were being obtained with an ABG. And like for example that we're gonna tell the patient that the ABG is a different one because we're gonna extract it in the artery, where the purpose is to check the oxygen levels in their body, and also to make sure that the therapy that they were being given is doing well for them. So moving on, we're gonna wash our hands. After washing our hands, we also have to dry it, and then we should wear appropriate gloves, clean one. And also after that, we also have to prepare the necessary items. Make sure that all of them are complete, such as the needle, the stopper, the safety cap, the band-aid, the gauze, the label, and also alcohol prep pad. So after that, we also make sure that we have to check the patient's ID band, make sure that we're able to know that the patient is the correct one. And also we always make sure that every time we do anything, we always make sure that we assess the patient, check the vital signs, and also most importantly when doing EBG, make sure we're gonna obtain a temperature. So after doing everything, we gonna move on in doing the extraction. So first is we gonna let the patient hyperextend their arms, such as like this, and make sure we're gonna explain it to them that they should be able to open and close their fist for about 3 times until we notice the color would return back to normal. So that is what we do with the modified Allen's test. If we notice the modified Allen's test on this arm to be negative, we always make sure that we're gonna do it on the other arm. So once we notice it also, by the way, if this one is a positive modified Allen's test, so we can proceed in doing extraction. So when doing the modified Allen's test, when doing the open and close fist, we always make sure we occlude both the radial and ulnar artery until after the third open and close fist. We always remove it from the ulnar artery until we notice the color, and we will also notice there is a bounding pulse from the radial side. So also we have assuming there's a tissue present, so we make sure we're gonna put it underneath to allow hyperextension on the patient's wrist. And then after that, we always have here the alcohol prep pad. So the alcohol prep pad, we make sure that we're gonna clean it in a circular motion. I'm gonna allow it to dry, and then make sure that we have here the syringe. Always make sure that we check the syringe if there are no any such as bended needle. If thus, we always make sure that we replace it with a new one. So once we're going to extract, make sure we're gonna feel it with the pulse, and then once you sense the pulse, make sure we're gonna position it in a 45-degree angle, and then the position is like you were holding a pen or a pencil, and the bevel should be up like this. So assuming that we sense the pulse, we always make sure we're gonna extract it carefully like that, and then until we notice some blood going inside the syringe. If we notice the syringe to be full of blood, we always make sure that we have a clean gauze present. So carefully remove it, and then apply pressure for about 5 minutes. If the patient is taking up blood thinners, we should always make sure that we're gonna apply pressure for more than 10 minutes. And also, when able to remove the needle, carefully remove, put it up in a stopper like this, and then with the stopper, carefully remove it with the needle, and then the needle with the stopper all together should be dispose it in a proper waste disposal or in a sharps container. So assuming both of these are already disposed, make sure we also have another clean gauze to remove any appropriate air present